My, I am not the physical therapist doctor. I am Dr. Hakim, father of John Hakim. But Dr. Isam Awad is the head of the Department of Physical Therapy at the University of Minnesota. He wrote so many books and taught us a lot about improvement of movement in patients and other people. He came with us here to support this project, and I'd like him to speak to you. And all of us can learn from a quality doctor like that. He was the head of the Department of Physical Therapy for 20 years in Minnesota. And I'm grateful for him to come and teach us what can be done in this subject and his ideas about stem cells. Isam Bey.
I came here really to learn from what this meeting is about rather than speak to you. But I was asked to speak, and I'll make my statement very brief. I did spend 35 years at the University of Minnesota, head of the Physical Medicine and Rehabilitation Department. I spent a lot of hours and a lot of years attempting to help people, especially the young, with disabilities, particularly spinal cord injuries, head injuries, and the cerebral palsy children, for which I wrote a book on what I did for them. So I'm here to testify that this is a ray of hope coming to prevent the disabilities that I lived to treat for years. I'm hoping definitely that this method of treatment would help people before they develop the disabilities that we spend our lives, that I spend my life treating. There is no question that a stem cell has a tremendous ability or capability for it to regenerate nerve cells, muscle cells, even muscle in the heart, cardiac cells, many conditions like the doctor mentioned earlier. I think Dr. Stein mentioned ALS and amyotrophic lateral sclerosis and so forth. So it's our duty to open the door for new methods of treatment. To tell you a short story about eye surgery, while the eye surgeon is here, I used to assist in treatment of cataract in 1958. That's before some of you were born. We used to put the patient with a cataract after treatment for cataract in bed for 20 days, believe it or not. 20 days lying down with the eyes wrapped with the sandbags on both sides. Today, you get the cataract treatment and you go out golfing in the afternoon or the second day. So there's no question there is tremendous improvement in medicine, and this is, I believe, is one of them that we should pursue and open the door for. Thank you.
I am Dr. Hakim. As I said, I'm the father of John Hakim. I should mention about Dr. Isam Awad. His contribution to medicine is unique. Not only he wrote books, but he produced 3 doctors, first-class doctors, and one of them is an ophthalmologist. And this can help all of you and us. From my side, 2.5 years, we had no one single international patient treated in China. On the 5th of September 2005, I went to China and we looked at 2 patients. One of them had bilateral hematoma of the brain. It was drained and he was completely comatose after he was drained for 50 days. And we give them injection of spinal injection of stem cells. A week later, I went to visit with him. He was completely awake. For me, this was a miracle. I have been in medicine for 50 years. I never saw anything like that. I have an MD and PhD in physiology, so I know a little bit about medicine. So the second case was a case of stroke. And the lady, 63 years old, couldn't walk on her left foot. I saw her, and I told her, stand up. She couldn't stand up. Her leg buckled under her. And the same day, when I saw her, they gave her spinal fluid, 3 cc's of stem cells, 15 million of cells. A week later, she was able to walk. We don't talk about our patient. Seeing is believing. In another word, the patient will come, we take a picture of him coming, he will be examined by his doctor, he has a report, and before he leaves, we take another picture and we'll send him to his doctor. So we don't propagandize anything about patient. Patients talk about themselves and people can see. This is why we are very strong about what we say, and we stand behind it because the patient is showing it. That's enough. I'm not going to give a big lecture here. But another thing I'd like to clarify. We take the hospital, the Chinese hospital, the arrangement in the Chinese hospital is completely not acceptable to us. If we take a floor in a given hospital, we revamp the whole floor, we modernize it. Any place we work with is up to date, as good as any American hospital. And this was not shown by talk, but by pictures, by visit. People visit these hospitals. So we take care of our patients. Then the expenses, you spend $20,000, $30,000. If we want to open a center in Costa Rica, it will cost you around $100,000 to stay for a month in the hospital. This is why it is very difficult not to do it in China. A CT scan in Minneapolis cost me $5,800. In China, they charge $150 using the same machine in our department. We have 12 centers, all modernized in China, and 1 center in Bangkok. We are opening a center in Panama and other places, in Romania and Hungary. So we are moving forward, and without success, we cannot do that. And people in the past, when have a sick patient who cannot see, cannot walk, he is spastic, and his doctor will tell him, nothing can be done about it. That's where we stop. We are telling everybody something can be done about it, and we are showing it. So those are the main things I like to bring to your attention, and we are growing up and bringing many people with knowledge and experience to help us, and we are begging the medical community to take what we have, improve it, and produce it, and give it to the patient they need it, and don't discourage patients from use the facilities that we have while they cannot help them. And thank you for listening.